gorgeous RX system. I have women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. Well, today we're going to continue our talk. And again, this is Dr. Jocelyn with us. Dr. Jocelyn, how are you doing today?
I'm fantastic. How are you?
Wonderful, wonderful. You want to introduce yourself again?
Absolutely. Thank you so much. I am Dr. Jocelyn, Johns Hopkins University educated board certified endocrinologist, upcoming author, and national speaker. And I help physicians and mid-level providers get better diabetic control for their patients. And today I'm going to talk to you about patients with diabetes.
Yes, we are. We're going to talk about skin changes in patients or people with diabetes. Mm-hmm. And so, Dr. Jocelyn, what have you seen as an endocrinologist? What do you see in your clinic?
I see patients who come in and they may vary in terms of how long they've had diabetes. Some of them are pre-diabetes or very early diabetes, and some of them have had diabetes for a very long time. So the skin changes that I see can vary based on those patients. So patients who are very early in their disease or may still have pre-diabetes can frequently get something called acanthosis nigricans. And it is a darkening around the neck, particularly in the back of the neck. And it is a kind of a velvety texture to the skin, but it's very dark on the back of the neck or also in the armpit area. And it may even precede them actually being diagnosed with diabetes. So I sometimes see it in patients who have pre-diabetes or polycystic ovary syndrome, but it is a sign of insulin resistance.
Okay, yes. And, it's funny because I know in my office, we see patients with that condition too. And, especially with the younger children, like adolescents or teenagers, the parents are thinking the neck is dirty, that the kids are not cleaning their neck. Mm-hmm. And, and I'm touching the neck. It's like, no, it's not dirt, And so now what we do besides checking checking the sugar level, I use a exfoliator to help, lighten it up and peel off the skin, because there's definitely a overgrowth of skin, but then I usually have them use a bleaching cream to try to lighten it up too. So what do you find that works when you guys have this problem?
Well, because it's a symptom of insulin resistance, we want to do things to help lower the insulin level inside the body, and nothing works better than exercise. Exercise, even in the absence of weight loss, will help lower your insulin levels. So I definitely recommend exercise, particularly when I'm dealing with patients who are younger, because they may not necessarily understand how to adjust their food, but you can definitely encourage some more outdoor playtime or have them join a team sport, something that's going to give them more regimented exercise on a daily basis. If people are older, I have them join a gym or start a walking program or take a dance class. There's all types of options, but nothing works better than exercise. Other than that, we use other medications that make the insulin work better so the insulin levels can be lower inside the body. Typically, it's metformin, and that can be used up to 2,000 milligrams a day. And sometimes if that's not working well enough, we may try some other medications that typically used to manage diabetes, but they work by lowering the insulin level inside the body, and that will help clear that condition up.
Perfect. Now, do you find that if once they start changing their habits as far as regimen, some type of exercise regimen, their foods they're eating, do you find that goes away on its own, or do you still need treatment?
Generally, it gets better significantly on its own because it's, again, tied to the insulin levels. If we can lower the insulin levels in the body, and we do that with exercise, metformin, some other medications, some of them are injectables, some of them are pills, we can actually get significant lightening in the neck without having to do any additional therapies.
Okay. It's just, I guess, the patients I have, they want it gone today. so definitely. But anyway, so do you find that you actually use that besides, of course, checking their sugars? Do you find sometimes you use that as a marker too to see how well they're doing?
Absolutely. Okay. And it's actually one of the things, even if they come to me for reasons other than diabetes, if I happen to notice it during the exam, that will be a reason for me to check for diabetes, to check a fasting blood sugar, and to check an insulin level, even if they're coming for a completely different reason.
Exactly. Okay. So yeah, that's what we always just definitely check a pre-fasting, glucose level. And I've been surprised when I've seen it with kids and, you have to give that news to the parents. But they definitely go and get that taken care of. So it works out very well. Right. So I'm glad it is a marker, because some people don't even know they have elevated sugars. Exactly. They're walking around and they have no idea, especially in kids and young adolescents or children. And that's a concern. So I'm glad that it is a marker, that we can see that without them knowing what's really going on internally,
Right.
So my other thing, we talked about this yesterday, and we mentioned skin tags again. So yesterday about we see it in weight gain, but you also see, like I do, in patients who have diabetes, correct?
Right. And again, in the same areas, because it has a similar etiology, that the insulin levels are very high. So again, you'll see it around the neck. You also see it around in the armpit area, and you'll see a lot of skin tags. There is also a hormonal condition that causes a lot of skin tags. So if I have someone who suddenly develops a lot of skin tags, they'll tell me that over the course of the last year or so, their entire neck is covered in skin tags, or across the back of the neck is covered in skin tags. That would also be a reason for me to assess them for a pituitary tumor. But in general, if they're just having a few, it's more likely to be related to high insulin levels and their diabetes.
Now, I do know that some people with skin tags, they tend to get more, not as fast as like you mentioned, but just over time, they keep getting them and getting more of them. We see it with increasing weight gain. Could you say that's correlated with also with sugars that's not controlled, or you really can't make that correlation?
I can't make the correlation necessarily with poorly controlled diabetes, but definitely I see it in early diabetes. And I think that we may just not look for it as much, because now we actually have better ways to look to see what their control is. So we don't necessarily use that as a marker to follow. But when I have people who come in early, that can be a concern. But if they are rapidly developing a lot of skin tags around the neck, then that may be a reason to actually assess for a pituitary tumor that can cause a lot of skin tags.
Okay, fair enough then. And so for us, I know how we treat skin tags, we just remove them, with a very sharp, fine scissors. We take them off. Some people you can use liquid nitrogen to burn them off, and then others we can use a cautery, a little device that burn. We actually let a hot temp that we touch the skin with, and they just come right off. And at home, when people do not want to pay, because it is considered cosmetic to have these removed, they will tie a string around it. Some people, I think I was told, dental floss or any type of clean string around it and strangulate it, because it does have a blood supply and it just falls off.
You just want to do it as close to the base as possible if you're going to go that way. But exactly. But either freezing them off or burning them off tends to be a safer way to go, and it gives you a better cosmetic result.
Exactly. So great then. So, with diabetics, patients with diabetes, we talked about other findings, and, you mentioned a lot of skin changes as far as infections. Yes. And, we talked about yeast yesterday, which is candidiasis, and we talked about how we treat that with antifungals and then trying to keep the area dry and clean. So, because especially under the breast, where my clients tend to have it, and then under the stomach folds, it stays moist. And definitely, air drying that after you shower, and then putting some type of powder there that does not contain cornstarch. So, to keep it absorb that moisture, you want something to absorb moisture, but not feed it with cornstarch. Because in the day, that's what people used to use, not knowing what they were doing. So, but anyways, what other findings have you seen with people with diabetes?
With people, particularly if the diabetes is not well controlled, you'll see a lot of skin infections. So you'll see like folliculitis, so people who will get issues with hair follicles, whether they shave or not, or furnicles or boils, again, under the breast, in the armpit, in the inner thigh area. Those can be significant for people who have poorly controlled diabetes, or even have early diabetes, may not know that they have diabetes. That may be the first sign that they're having a problem.
Okay.
And people who've known that they've had diabetes for a long time, sometimes if their control has been good, but their blood sugars suddenly shoot up, it may be because they have an infection that they didn't notice. And then once you notice that and treat the infection, the blood sugars will come back down.
Okay. And then something, I don't check for diabetes when I see patients who have a carbuncle here or carbuncle or even folliculitis, but that's definitely something I would start incorporating, because when I have people who come back, have repeated infections, it's like, why do you keep getting this infection? Yeah. And I tend to go towards the nose, because a lot of times people tend to have a sinus problem and they rub their nose a lot, and the bacteria actually lives there. But I definitely never thought about checking their sugars to make sure. That's a concern too.
Yeah,
So I definitely would think about
I think that if you see it as a recurrent infection, I definitely would have them check for blood, have their blood sugar checked, have them check for diabetes, particularly if they have a family history for diabetes, or if they have other risk factors for diabetes.
Yes, that's a good thought. Thank you.
Mhm.
All righty. And so other changes that you see that are more for people who have a chronic, definitely chronic, uncontrolled or prolonged history of having diabetes, what have the skin changes you see?
There are a couple other things, not so much on the face, but more on the lower extremities, which make it difficult for people if they want to wear, certain shoes or shorter or skirts. You can get a darkening of the skin from chronic edema. So if you have poor vascular circulation because of prolonged diabetes, you actually can get swelling of the lower extremities. And when the swelling has been there for a long time, it actually changes the color and texture of the skin. And so we get skin changes consistent with chronic edema, and that can be very problematic and difficult to manage because even once the edema goes away, for a long time, the skin changes may not go away completely. And secondarily, we see something called diabetic dermopathy, which is when you get frequent micro trauma to the area. So if you're constantly like walking into the coffee table or moving something with your leg, you may notice on the area that gets that kind of abuse, you actually start to lose pigment in that area because it doesn't heal as well because of poorly controlled diabetes. That tends to be a more advanced finding, but it is something that we see on the skin with people who have diabetes.
Exactly. And when you talk about the chronic swelling, like I said, I know for my female patients, and over time, we tend to, as women, we tend to have a little swelling of our legs anyway, as we age. And not enough that you're going to have these changes, but definitely if you add that to a person with diabetes that's uncontrolled or just have it for a long period of time, you tend to have more swelling. And what you're going to notice first, I see is the coloration, more, like you said, increased discoloration, but also no hair. The lack of hair in the area. And like you mentioned, the skin changes where to the point they don't want to wear any dresses to show their legs because they're so embarrassed of the skin changes. Right. But I notice I tell patients when they do have this swelling to really, especially in the wintertime, if they're wearing pants, to wear support stockings and put them on as soon as before you get out of the bed or as soon as you get out of the bed and then take them off at night because having fluid in the skin, I call it stagnant water, it gets infected. It's a setup, a breeding ground for infections, bacteria overgrowth. And sure enough, they end up with another problem, which is, infection of the leg, which is really hard to treat. And sometimes they end up in the hospital with this problem. So that's what I've seen in my office. And so thank you for that.
No problem. I completely agree. And I also recommend that when people come in with issues of swelling, number one, there are some medications that can contribute to the swelling. So if that becomes an issue, we may need to change some of their blood pressure medications if some of them cause swelling. The other issue is that the swelling is really more of a salt issue than it is a water issue. So going over their diet in terms of what they're eating is important because a lot of times they will be eating a very high salt diet. And that causes them to hold on to a lot of fluid that actually makes the swelling worse. So if they can reduce the salt in their diet and actually exchange some of that salt for potassium, we'll see the swelling go away. And the one thing I make clear to them is that it doesn't matter if you're adding salt to your food if you're eating a lot of salty food. A patient who came in earlier today who was complaining about swelling, and his breakfast was sausage, bacon, biscuit from a fast food place. He had pickles and potato chips for lunch, and then he had pizza for dinner. And he's like, I don't know why my legs are swelling. Well, because you had I didn't put any salt on anything. You ate a lot of salty foods all day, and now your legs are swelling because you're taking in too much salt. So it doesn't matter. Your body doesn't care where the salt comes from. It does matter that the salt is there, and that's what it's trying to get rid of.
Exactly. And I'm glad you said that because, like I said, I'm thinking of it's more of a water problem, but to know that they're just so used to eating a salt diet. That's the key. Right. They don't even realize they're eating heavy salt, in their foods that day or whenever they have this swelling problem. But I'm glad you mentioned that. So that's definitely something that has to be looked into. And I'm glad you mentioned that because it goes back to how we need to look at the person as the whole body, not just as this one problem, but like you mentioned, hey, it's not a water problem, it's a salt problem. So we need to go back to something basic of what are you doing? What are you eating? And how much of it are you eating? Right. So, definitely it goes back to the whole body. So I do want to thank some people for joining us. There's Ms. Tate, Ms. Myers, as well as Dr. Celeste. Thank
Hello,
you. Do you
ladies.
do you all have any other questions that you would like Dr. Myers, Dr. Jocelyn Myers, or myself to answer? If you do, please put it in the comment section, because we definitely want to answer anyone questions. And if we didn't mention it, and you do have questions about diabetes, please, that are found in in patients, please let us know, because we're talking about mainly the findings that you see in people, women between the ages of a certain age. We're not going into the really deep detail of patients who have diabetes for a very long time, or with chronic diabetics, or patients who have a very extensive, high elevated diabetes, sugars for a long period of time. So we're not going into deep into that. But if you do have questions that you want answered, please put it in the comments section. We can answer those questions for you. So Dr. Jocelyn, I do have your Facebook where, if people want to follow you and get some other information about not just patients with diabetes, but also with other endocrine problems. I have your Facebook listed below.
Yes, it's Dr. Jocelyn, MD. That's DrJocelyn, MD, on Facebook, also on Instagram and Twitter. And I just wanted to mention one quick thing about the salt in the food, because that comes up a lot for patients. It's also to understand that if you are seasoning your food with salty things, that's also going to be an issue. So you may want to change out your seasoning. So if you're using onion salt, garlic salt, seasoned salt, to change to onion powder or granulated onion, or garlic powder, or granulated garlic. Using other spices is going to be a better way to get those seasonings into your food without adding the additional salt. Because again, your body doesn't care where the salt comes from. A lot of times people get into the habit of seasoning their food one way and then thinking as long as they're not adding additional salt, they're okay. But if the salt is there, the salt's already there.
And it's funny, because I know years ago, I have family members who were diagnosed with having diabetes, and sure enough, they were told to, get Mrs. Dash and all these other products, seasonings, different seasonings that are over the counter. But I know at the time, that's when it was really popular then. Right. But I find that what I do when I want something salty, but I don't want that salt, I go and get balsamic vinegar. And it's a salty taste, but when you look at it, it's no salt.
Right.
And so I find that to help me, when I'm eating vegetables, and I need a little more than, especially after you steam vegetables, you don't put no salt on it.
Right. Yeah.
I need some taste.
I'm a big fan of granulated onion and granulated garlic. So
okay.
It's just kind of in a powdered form, and it gives a great flavor. You don't have to use a lot because the flavor has been concentrated, but it does not add any salt to your food.
Okay, great. Well, thank you. Anything else you would like to add, Dr. Jocelyn?
No, I just want to make sure that let people know that, again, all things can go back to are interconnected. So there are skin changes that go along with having diabetes. So it doesn't have to be that everything is just about what your blood sugar is. You also want to make sure that you're taking care of the whole person, the whole body. And if you're noticing changes, even if they're on your skin, that doesn't mean that it's not a severe issue and it doesn't need to be evaluated.
Exactly. The key is to catch things early, or not to even get it at all. Let's just go there. Yep. So just because you may see changes that, you see the doctor and they tell you how your sugars are elevated, it depends on how elevated they are. But usually if they're just slightly elevated, a lot of doctors I know, they tend to want to change the diet, work on the diet and exercise, and have you back after a period of time before they add on medications.
Well, is always key. Sometimes, like again, for me, because I'm a specialist and I see people who are referred in, but diet and exercise is always key. I always address diet and exercise at every visit, but medications, may be necessary to help. But but the medications are not instead of, they're in addition to. So diet and exercise is always a foundation for management.
Okay, but great. Well, thank you again, Dr. Jocelyn, for joining us, and thank you. Yes, and thank you, ladies, for joining us too. I do appreciate it, and doctors. Okay, so I'm Dr. Johnson, your host. I'm a board-certified dermatologist and creator of the Gorgeous RX system, as well as a Amazon bestseller. I help women who want to have even and clear skin tone with increased confidence. Thank you for joining us today, and we will see you tomorrow. Everyone have a wonderful evening. Good night.
Bye-bye.
Bye-bye.